coding experience could use a large language model to be used as a clinical interface tool to make a predictive model for postoperative length of stay in appendicitis. So we chose appendicitis because it's a very common pediatric disease with readily available perioperative data. And length of stay is significant because it matters for hospital resource utilization, OR scheduling, and family expectations and planning. So importantly, before we start, it's important to realize ChatGPT did not make the prediction here, but was rather used to help us assist creating a predictive model workflow. So why does this matter? Traditionally, predictive modeling, it requires coding experience, it requires statistician support, and institutional informatics resources. For many clinicians, however, these barriers are really too big to participate because of timing constraints and also just lack of background. A lot of clinicians kind of take a backseat role in the process. But potentially an LLM-assisted workflow can allow physicians to interact with natural language prompts, receive code generation, and get guidance on pre-processing to help them play a larger role in the process. So what we really wanted to do is ask, can ChatGPT help physicians take a more direct role in making predictive models? So quick disclaimer on responsible use of AI. No patient identifiable information was entered into ChatGPT, and all our analyses were ran offline with de-identified data only. So ChatGPT, what it did was it worked in the background in workflow guidance, pre-processing recommendations, code generation, and visualization planning. But the modeling, validation, and interpretation of the results were all our own. So in other words, it functioned as a clinical research assistant for us, but not an autonomous decision maker. So we did a retrospective cohort study of a single surgeon's experience between January 2023 and December 2024. We looked at outcome postoperative length of stay. After exclusion, we had 225 patients included. These are our cohort characteristics shown. The median age was 12 years, 8% were perforated appendix, and the median length of stay was 0 nights. And this shows that in pediatric appendicitis, often you're discharged the same day from the hospital. So this is a rough schematic of our workflow. So we started with putting perioperative variables that were de-identified in ChatGPT. ChatGPT then gave us strategy on pre-processing, for example, how to deal with missing values or how to organize categorical variables, and it gave us the train test strategy. So then ChatGPT generated Python code directly by which we ran the linear progression in the random forest models. These models were trained on an 80-20 split with a held-out test set. So what this means is basically 80% of the cohort, the model sees all the data, including the answers. In this case, the answers is like length of stay. And then on the 20, it's tests. So we'll go over the tests on the next slide, and the 20 it guesses, essentially. And we performed our evaluation with the MAE, RMSE, and R squared. So this is the random forest model. So these are the some of the perioperative variables we input here on the left. So what happens is multiple independent unique decision trees make an estimate of the length of stay, and then for the overall prediction in the model, you get the average of all these estimates. And I should have brought my paper here because I forgot what those acronyms stand for. But mean absolute error. As you can tell, I'm not a statistics guy, so that's kind of the moral of the story. But mean absolute error, root mean square error, and R squared. And obviously you want a smaller error and a better correlation coefficient. So again, the take-home message is not that ChatGPT itself came up with length of stay, but that it was used to generate this random forest model. So these are our results. The linear regression is on screen right, and then the random forest is on the left. So we found that, well, essentially looking at this, the closer the dot is to the diagonal line, the better the model performed. We found that through all the metrics, the random forest model outperformed the linear regression. So this tells us that a random forest model in this setting might be more desirable than linear regression because it can really distinguish kind of meaningful complex variables between perioperative variables. So these were the most important predictors of length of stay in our model. So what does this mean? Feature importance is basically how much influence each variable has on that overall outcome. So for instance, age with a feature importance of 0.2, 20% of the decision-making capacity was from age. So our most important predictions were age, preoperative white blood cell count, maximum temperature, and these are all verified in the literature as well as predictors in appendicitis. And all the feature reports should add up to 1. So our study has several limitations. It was a single center study only, and it was only over a year, and it was looking at 1 surgeon. Our surgeons together easily do over 2,000 appendectomies a year, so we're going to expand our cohort. Our model only performed moderate at best, and certain characteristics such as operative duration is not a truly preoperative variable. But overall, it showed feasibility, and we're working on additional refinement of the model towards a clinically actionable prediction model. So our next model, we're focusing more on, instead of length of stay as a continuous variable, we're focusing on more binary outcomes, such as same-day discharge versus need for inpatient observation over 24 hours. We're also trying to capture more granular data. So when did the patient present to the ED? What time was their surgery and when were they discharged? We think that this could help kind of set up OR scheduling, determine first case start, determine overnight versus next day surgery, and overall just help allocate resources. So in summary, we think that this work can move toward a LLM augmented and actionable, clinically relevant clinical decision support tool here at Advent Health. Thank you.